Electronic Medical Records, presented by Daryl Vega, Deidre Greenaway, Chardon Hunt, Fallon Bai, Trinity Gomez, Vanessa Braithwaite. Introduction to Electronic Medical Records. The implementation of electronic medical records is a major step in the right direction that will improve efficiency and enhance relationships between providers and patients. EMRs help providers make better use of personal medical histories by allowing them to target the individuality of their patients, which in turn significantly improves quality of care. Clinicians use this technology to retrieve vital patient information and health history to be used upon assessment such as laboratory testing, radiological testing, and physical examinations, to name a few. Electronic medical records are key to the process of digital medical record keeping. EMRs have become a major improvement to the delivery of care. Some of the benefits are that they allow for accurate entry and tracking of patient information, contains all medical history, pharmacological history, and other vital patient information. EMRs are also cost effective. They allow quick and easy access 24/7. They have the ability to coordinate care with patients and other providers and share information with patients and family members easily. They also help to enhance the quality of patient care, for example, minimizing unnecessary testing. Not only are EMRs beneficial to the physicians and patients, but they are very beneficial to HIT leaders and other departments in a healthcare organization. HIT leaders oversee all technology that is utilized in the organization, and they are responsible for keeping that technology running properly and pulling necessary data. Having EMRs not only allows clinical staff to care for the patient more efficiently, but it benefits HIT leaders by allowing them to analyze collected data for continuous improvements in care and to provide a big picture for the organization. HIT has provided another aspect to efficient healthcare, and while it is a challenge to keep up with the changes, it allows the healthcare industry to run more seamlessly. With the rapid changes in the industry, HIT leaders are aware of the importance of EMRs and the benefits associated with them. They continue to incorporate those changes into the current systems and find new ways to make healthcare more cost effective, efficient, and safer. Implementation of an EMR system involves a substantial amount of technology that, depending on the size of the practice or organization, can take months to be fully operational. Some of the hardware involved are desktop computers, laptops, tablets, electronic clipboards, electronic signature pads, keyboards, mice, and digital cameras. A lot of health organizations, especially larger ones such as nursing homes and other types of long-term care communities, are using photos attached to EMRs to help medical personnel better identify. In addition to the hardware that is involved, most EMR systems need some sort of platform, which could be Windows, Macintosh, Linux, or web-based. While the platforms provide the operational foundation for EMRs, there has to be some sort of advanced word processing technology that provides the templates for medical record documentation and also reports. Additionally, EMR systems must have a storage component. All the documentation from patients' medical records must be housed in some sort of central location. Some practices are using cloud technology, while others may be using servers. This type of system allows the patient to have secure access to his or her medical record as it is updated by the physician and medical team. Patients have access to their immunization records, labs, and test results, visit notes, and much more. Having access to all of this information instantly has its benefits. For example, when a mother needs to access vaccination records for her child for school purposes, she no longer has to contact someone at the provider's office to fax or mail a copy of the record. She can simply log into the system and print or even email the information where needed. Who are the stakeholders or users of electronic medical records? They are hospitals and healthcare networks, physicians, medical staff, and patients. Hospitals and healthcare networks and physicians' offices. Some of the benefits for hospitals and healthcare networks are clinical quality enhancement, improvement in patient care, operational efficiency, timely reporting of communicable diseases, In the hospital setting, electronic medical records are standard in the improvement of communication as well as the longevity of medical records. Some of the benefits for physicians and medical staff include expedient retrieval of patient medical records and medical history to be used upon health assessments, laboratory testing, radiology testing, ordering of prescriptions. EMR also helps prevent prescription errors. Some of the benefits to the patients include online access to their medical records, appointment scheduling, review of personal medical records, ordering refills of prescriptions, direct contact with their primary care physician and clinical team by email, free information on health and wellness. What do the users of electronic medical records feel about the technology? What they expect: results in patient outcomes, improvement in workflow, improvement in efficiency, savings for the business and patients. What they have gained: reduction of erroneous testing, reduction in erroneous administrative practices, better management of chronic illnesses, enhancement of overall patient care. Acquisition of the EMR system. The cost of adoption of electronic medical record systems can run from $50,000 to $100,000 or more, depending on the size of the practice or healthcare organization. Title IV of the Health Information Technology for Economic and Clinical Health Act of 2009, High Tech, provides financial incentives up to $63.5 thousand per health care provider who implement an EMR system that is certified by an Office of the National Coordinator for Health IT authorized certification body. Government assistance. In 2004, Bush announced that by 2014, he wanted all citizens to have access to their electronic medical record. This ambitious goal is still being supported by President Obama, who announced that there would be nearly $20 billion in stimulus money available over the next 5 years to providers who implemented the digital record systems. Some of the incentives include decreased costs of implementation, streamlined patient access, increased interaction between patient and provider, quicker response on results to patients, and higher quality of care. Regulations with results: increased quality, billions of dollars saved, aging patients see electronic medical records benefits, and increased interoperability. Impact on the patients include cost. Initial costs will be inflated due to implementation, training, transition from paper to electronic records. Costs will begin to decrease and level out over time, which will result in reduced labor costs. Patient impact. Privacy. Improved patient privacy rule is needed. Protects how patient health data is used and disclosed. Impacts of privacy rules. Limits accessibility to patient health information. The value of EMR. Reduction of errors. Data can be audited electronically. No more errors due to poor penmanship. Real-time data is available. Better communication and documentation. It is reviewed by the healthcare provider and the patient. EMRs also automate workflows. Health information technology for delivery of healthcare. EMRs have several advantages over paper records. EMRs can use information on patients' medical histories to improve quality significantly by reminding providers of the best methods of care for specific patients. Electronic medical records are an improvement to the delivery of care and cost-effective. The Health Information and Management Systems Society stated that an electronic medical record is a longitudinal record consisting of a person's health information from one or more interactions in any care delivery setting. EMRs allow accurate patient information, ability to provide quick access, ability to coordinate care with patients and other providers, and share information with patients and family members. Macro trends affecting EMR. The federal government designated the Department of Health and Human Services as the executive agent to create and enforce the guidelines that will be incorporated into the Electronic Health Records Program. The Office of the National Coordinator for Health Information Technology Health IT Certification Program helps to ensure that health IT conforms to the standards and certification criteria adopted by the Secretary of HHS. Healthcare organizations must meet strict EHR guidelines and obtain approved certification in order to be eligible for federal government financial incentives. The Office of Health IT Certification was established to develop and oversee national programs for the certification of health information technology by the Health Information Technology for Economic and Clinical Health Act. HITECH provides HHS with the authority to establish programs to improve healthcare quality, safety, and efficiency through the promotion of health IT, including electronic health records and private and secure electronic health information exchange. Healthcare organizations must meet the meaningful use requirements to successfully implement the EHR program and apply and receive financial incentives. The process includes various stages that lead to successful adoption and will reduce any consequences associated with such adoption. References.